Hey everybody, how's it going? Thanks for stopping by again. Today I'm here with Aisha Jangir, who is an NDP candidate in Guelph, Ontario. She's a labor activist, she's a registered nurse, and she's a champion for public health care. So we're going to be talking about all of those things today. Aisha, thanks for stopping by.
Thanks for having me.
Aisha, tell me why you're seeking political office and specifically why you want to run for the federal NDP. Why federal politics? Why the NDP? Why now? What drove you to this type of community service?
So I've been working really hard on wanting to support the need for national pharmacare, and this was going back for over 2 years. So I was working alongside the Canadian Labour Congress, and I was also working along with the Canadian Health Coalition, lobbying MPs long before the platform was introduced by the NDP. I recognized in my work that there were decisions that were being made at government levels that were impacting our ability as registered nurses to provide care for our patients. So I wanted to be at those tables and wanting to help with the decision-making process.
Certainly, I think that's a great point. I think that, I've talked to Matthew Green and I've talked to other people who were, before they decided to run for federal politics, great local activists, whether, through their unions or community groups, or with Matthew Green through, city council. And he wasn't, talking down that local activism, but I think what he noted was that, at the end of the day, you really do need that voice at the highest levels in some cases to really impact that change.
Mm-hmm.
Sort of building off that, you noted that you also are a labor activist. I saw that on your bio. You have extensive involvement through your nurses union, but also through the OFL and the CLC. And I'm wondering how your labor activism has sort of informed your politics, your decision to run, how you involve yourself in the community. Like, what are the linkages there?
Right. So I was first introduced, well, I've always been a NONA member when I started nursing. So that was back in 98. And when I started to take on some positions within the executive and further worked my way up into the position of local coordinator, that meant that I had the opportunity to understand the dynamics and the influences that government has. So working, trying to understand the Ministry of Health and Long-Term Care and how that impacts our ability to provide care as registered nurses. So getting involved, participating, understanding, asking questions. I mean, I have learned so much from the work of the union, more from the work of the union about what my role is as a registered nurse than from my regulated college.
No, certainly. I think that's a great point. I think a lot of time people think of unions as, just a mechanism to, get benefits and wages and perks for their members. And certainly part of a union's job is to negotiate for its members, in terms of better wages and whatnot. But I think people forget often that unions play a really indispensable role in improving the quality of a workplace. And whenever that workplace, deals with the public, be it, nursing, or even just be it, dealing with customers at a business, unions are often fighting for the improvement not only of their conditions, but for the conditions of those they serve. And I think that's something we need to talk about more. When nurses and teachers and other public servants especially, do talk about labor activism, they're fighting for the quality of life in the workplace and also for those in the community. And I think that there's a natural connection there. And building off that as well, like a lot of candidates, I'm sure you're spending most of your time going door to door, making phone calls, meeting with, people in the Guelph community. And I'd love to know, like, as you talk to your prospective constituents, what matters to them right now? Like, what are the issues speaking to them? What are the policies speaking to them? What are the concerns they have going into this election?
They're very concerned about the safety of the community.
Mm-hmm.
So specifically in Guelph, we have an opioid crisis. There's inadequate supports for individuals that suffer from mental health and addictions. So that's something that I'm very passionate about. I'm a mental health registered nurse. And so I know that there are things that we can do in order to provide supports. And that starts with making sure that there are adequate supports available that are funded by the government. It's very unfortunate when I've had to turn people down because they don't have the resources or the means to pay for these special programs. So we need to open up more beds, or it's to provide more addiction services, mental health services to support these individuals. And I think that's one way of dealing with the crisis that we have here. Often I'd have patients come to me and say, what I really need is I need programming and I need help. But there's limitations when it comes to resources that are available here.
No, I think that's a great point. Again, I think it goes to the fact that people on the ground are really doing their best, healthcare workers, community activists, but there are infrastructural and financial limitations to what local governments and even provincial governments can do. And this sort of carries on to the big question is that, what do you feel are the things that Jagmeet Singh and the NDP, the federal party platform, are offering in terms of healthcare? There are other issues, of course, but as you noted, healthcare being such a vital concern in Guelph and indeed in many communities across this country. What are the things the NDP is offering that you feel will help address this situation? Even though, healthcare is technically provincial, what do you feel the federal NDP is doing to improve or will do to improve healthcare for the average person in Guelph?
So I'm really excited when they've introduced National Pharmacare as being part of one of their top priorities. And I think it's long overdue. When we talk about Medicare, we recognize the values that are associated with that, with equality and fairness. Why is it that Medicare currently only covers a hospital visit or a doctor visit? It should be extended to include pharmacare. And Jagmeet Singh and the NDP platform takes it even a step further by ensuring that there's dentistry, vision, hearing, and mental health and addiction services. So it's great. It's comprehensive. It's complete. It's going to be universal. It's going to be accessible. It's going to be publicly funded. So I'm really, really excited about it, and I really want to work hard to see it, come to light.
No, I think that's a fantastic point. I think that in so many ways, the dream of healthcare, Tommy Douglas's dream, is only been partially realized, right? It's something that we can be proud of the accomplishments, but we really do need to do more. Until every Canadian person, regardless of their income, can get all the healthcare they need, not just not just a doctor's visit, but, to be able to get the prescription that the doctor prescribes, you know what I mean? That we haven't achieved that objective. And I think that, whereas other parties like the Liberals have sort of hinted at something of a pharmacare somewhat, I think we can credit, Jagmeet Singh and credit the candidates across this country for taking a clear stance, single payer, universal, coast to coast to coast, covering pharmacare, dental care. I think that's incredibly important. But I want to just touch on this a bit further because there's been a lot of attention given specifically to pharmacare and dental care. But as you note, this includes things like mental health, and that could, I think, be sort of tied in with, addictions and other forms of struggle that are affecting communities all across this country. And I think that's part of the plan, but it's getting a little bit less of attention. Maybe you could shed some of the light on that, given your experience, especially as a healthcare professional.
Yes, the great point. So when I'm looking at understanding the complexities that are brought to the table by a patient, and understanding the psychosocial stressors that they may have, such as precarious work, not having full-time employment, those are added stress that leads into anxiety and could eventually, result in depression as well. It's cyclical. So understanding that there are so many different factors and variables that play part on an individual's mental well-being, I think the least that we can do is ensure that people have the supports that are needed. So when I think about mental health supports and addiction services, I think about counseling supports, because there isn't like, one medication that's going to fix it all. People need more supports, and that includes counseling and services. We're seeing children and the rise of anxiety and depression that they're experiencing. There's self-harm behaviors that are occurring among our young children and adolescents. So I think it's really important that we understand what are some of those elements, and the least that we could do is ensure that we are, we're meeting their needs. And so that's why I feel so passionate about this Pharmacare Plus, I want to call it, because it includes much more than just medications.
No, I totally agree. It's about more than Pharmacare. It's head to toe.
Yeah.
You pay with your health card, not your credit card. I think it's a great advancement. And one thing I think that's really crucial is what you noted is that, talking about healthcare, it's not just talking about doctors and nurses and medication and beds. I mean, that's all very important. But you're right. The social context is incredibly important. And there was a story a little while back. I think it was from the United States where a doctor prescribed a higher minimum wage to one of their patients, which is to say, like, the primary health issue of this person is that they're overworked and underpaid. Mm-hmm. And like, we can medicate that, we can alleviate these things, we can through medical science, but we can't solve them without, better social equity. And I think that it's important to note that the Pharmacare plan is connected to things like, cutting interest on student loan debt, which will be so much less stress for young people, and investing in childcare and investing in housing. And when you invest in these things, you not only lower the cost burden on healthcare, because people that have secure and healthy lives are use health services less, but you also, I think, improve the mental and social health of society. And I think another factor we need to address is that, the NDP has a clear policy about decriminalization of narcotics use and things like that, which I think is vital because addictions are not crimes, right?
No.
They're health issues, and I think that when we make them into acts of delinquency, quote unquote, we create a situation where we create a cycle of poverty and of alienation. And I think Jagmeet Singh's plan to say, like, look, we're going to decriminalize fully is the right thing to do, not only for healthcare justice, but for racial justice and things like that.
Mm-hmm. And when you decriminalize the drugs, what happens is you also address the stigma that's associated with that.
Yeah.
And really, it's going to free up and give these individuals an opportunity and basically a second chance to life, right? You're really, truly understanding what their issues are, such as poverty and homelessness, and provide them the supports that they need so that they're not meeting with the cops as often as they are, or, we're really providing them the supports that's necessary.
No, I think that was a great point. So, Aisha, this was fantastic. This was a great chat. I really love talking healthcare with you. When you're elected to represent Guelph in the coming parliament, I'd love to have you on again. But before you go, let people know where they can find you on social media, your website, etc. Let people know where they can find you so they can learn more about you, maybe throw you a donation, whatever.
That'd be awesome. So through Instagram and Twitter, you can reach me at Aisha for Guelph. And then on Facebook, it's Aisha Jangir and the Guelph NDP.
Okay, excellent. Well, Aisha, thanks again for stopping by. Have a great one, and good luck with the campaign.
Thank you very much. Thanks, Crystal. See ya.